Afternoon, everybody, and welcome. So, as Mark says, I'm the Group Protection Claims Director. I also have responsibility for the health and wellbeing proposition within Legal and General and the Not a Red Card campaign. So the campaign and our mental health and wellbeing strategy actually sits under myself. So we know from research that 1 in 3 of us actually at some point will have a mental health episode at some point. We also know that 30% of individuals won't actually speak to their line, or 30% of individuals who are team managers haven't actually had any training around mental health. We know that 16% of individuals essentially aren't prepared to discuss their mental health. Back in 2017, before we actually launched the Not a Red Card campaign, we actually carried out our own research, and less than 10% of individuals said they'd be prepared to talk to a line manager about their mental health. And that's why we decided to do something at Legal and General. First off, it is about actually setting the foundation of where you are right now. So it's actually about having that baseline. Do you actually have a health and wellbeing strategy? And if you do, is mental health part of that health and wellbeing strategy? It's about understanding that base point and where you want to proceed to. So what we've actually used in the past is City Mental Health Alliance's scorecard, and that actually helped us to determine where we were on the baseline so that we can then plan our activities and put those into practice. It's vital that you actually gain leadership support. For those of you that were around this morning, you might have heard Nigel speaking. Essentially, it is about actually getting it on the boardroom agenda, because until such time as mental health is actually clearly addressed and companies are measured against mental health, unless you actually have a clear KPI, it's not actually going to get done. And so it was vital that we actually got buy-in, not just from Nigel, but the whole of the board. And we've actually got senior sponsors within the organisation who have actually stood up and explained about their lived experiences, so that we are actually raising that across the whole of the population and colleagues within Legal and General. So what do we do next? We actually look at building the framework and strategy. So it's about having a plan. And what we decided to do was actually use the foundation of the Thriving at Work report. So the Stevenson Farmer report that was actually published in October 2017, that was our foundation. Within that report, there are 6 core recommendations and standards for effective mental health within the workplace. For employers that have more than 3,000 lives, there are an additional 4. But initially, we decided to actually use the first 6. So by having a mental health first aid campaign, that actually will speak to 2 and 3. By training your line managers, that then speaks to number 5. So you are actually building your plan around those recommendations. To actually help, and I know these slides are going to be available on the REBA website, we've actually created a whole set of resources that can actually be found on the Not a Red Card website. And so this will be made available so that anybody wishing to actually use those resources can, of course, access them. So how do you actually go about recruiting your mental health first aiders in the first place? So it's really important that you actually have a wide range of your colleagues involved at all grades. And it was really important that we actually asked individuals to volunteer for those that had mental health concerns and issues themselves, but also so that others who wanted to learn how to help colleagues, friends, that they might have experienced individuals who'd actually suffered from mental illness in the past. They need to be able to dedicate their time not just to the training, but to be easily available. And of course, it's vital that they maintain confidentiality. So what we actually did is we actually asked individuals to volunteer, and then we went through almost like a recruitment process. And I have a team of 19 clinicians who actually work for me, and we actually did some initial one-to-one just conversations with those individuals to really ascertain why they wanted to be mental health first aiders in the first place, because it's vital that we actually safeguard these individuals as well. We, of course, provided training. There is numerous resources out there for training. What we also did was actually 4 of my clinicians became instructors. So they actually went through the Mental Health First Aid England instructor course, and they are now rolling out the training within Legal and General, but also more broadly if any of our customers actually want training as well. But of course, there is Mental Health First Aid England, who will provide the 2-day course, and many other organisations. There is also the 1-day champion and the Raising Awareness of Mental Health, which is also a half-day workshop. These are all vital pieces of resources that we can actually utilise to train individuals to become mental health first aiders. It's really important that our mental health first aiders have a clear set of guideline and policy around roles and responsibilities. As I've said, a number of our mental health first aiders are individuals who have actually suffered from mental illness, and we need to make sure they're safeguarded and that they actually don't take on some of the concerns and issues that they're actually discussing with people. So it's vital that we actually continue to support our mental health first aiders. And we are actually currently piloting a refresher training for them. We set out a guideline on roles and responsibilities, and again, that framework can actually be found on the Not a Red Card microsite. And essentially, it was about clearly making sure that all of our first aiders knew what their roles and responsibilities were. They are there to signpost and offer support for distressed colleagues. They're not clinicians, and they're not there to make any diagnosis. So it was really important that we emphasise that to them. They're there, as I say, purely for signposting and to offer that emotional support. Once we've actually put individuals through the 2-day course, and we started this programme back in 2016, and so far we have just over 170 mental health first aiders across the organisation. As Nigel mentioned this morning, we determined that we wanted parity between the number of physical first aiders we have within the organisation and also the number of mental health first aiders. So we went with a 1:70 ratio. We've decided that we actually then wanted a follow-up course. So individuals that actually get accredited for physical first aid have to go through a regular 3-yearly recertification. If we're going to have true parity between mental health first aiders and physical first aiders, we wanted to do exactly the same. So working again with Mental Health First Aid England, we've determined that we're actually then going to do a further half-day workshop that essentially gives the mental health first aiders further accreditation. So that's going to happen every 2 years. We set up the Mental Health First Aid Network, and again, that's part of the support and safeguarding. So at each quarter, my clinicians actually have regular face-to-face one-to-ones with the mental health first aiders. We also are on call via telephone, email. So if a mental health first aider has an issue and they want to discuss with one of the clinicians, we will actually provide that support. Now, we recognise in most organisations that support's not available, but it is really important that the mental health first aiders actually continue to feel supported in the roles that they're actually doing, because sometimes they do have to deal with some quite stressful situations themselves. And it is about empowering them to maintain their skills, hence the reaccreditation. And we review and report. So we report to the board on a regular basis using anonymous MI, because that's really quite important. And the whole point of what we've been doing is around the raising the awareness and reducing stigma, which is essentially why the Not a Red Card campaign was set up in the first place. I've mentioned the data, and I mentioned KPIs right at the beginning. And essentially, If you haven't got KPIs or you're not actually managing that data or monitoring, how are you going to really know what the impact might be? So it was very clear that we needed to set those KPIs from the beginning. So examples of hard data is, of course, how many mental health-related sickness days or absence days. How many calls to the employer assistance program do you actually have? How many individuals have actually contacted a mental health first aider? Again, the data is completely anonymous. Softer data, of course, is around communicating the employee's mental health and wellbeing journey. We actually have a quarterly staff survey, and we ask all of our people about their mental health, their physical health, and we actually ask for whether they've actually been involved in any of the wellbeing programs. And they actually helped us frame what our philosophy and our strategy was going to be right from the beginning, from the responses that they actually gave to us in the original surveys. And of course, we use benchmarking. As I've already mentioned, the City Mental Health Alliance scorecard, and we are members of the City Mental Health Alliance. It's really important that we look at external benchmarking and gauge where we are on this journey. It is a journey. We're not perfect, and we're still on a huge journey to aspire to where we want to be, to enable all of our people to bring their whole selves to work so that they really do thrive in the workplace. And I think I've got time for a few questions if there are any questions.